finding what the true value is that the clinicians deliver in their services or in their interactions with the patient throughout a course of care, and then finding a way to use technology to highlight those and cut the rest of the flack, if you will. So how can healthcare organizations successfully implement technology to enhance operational efficiency and improve patient outcomes? For me, this really stems on finding what the true value is that the clinicians deliver in their services or in their interactions with the patient throughout a course of care, and then finding a way to use technology to highlight those and cut the rest of the flack, if you would. So, for example, in the world of physiotherapy, physical therapy, a lot of time can be wasted going over things that the patient should already know or should already be doing. For example, home exercise programs or exercise routines. And instead of having the patient come in and spend 45 minutes to an hour, and half of that time is spent going over stuff that they should know or that they should have been doing, using some sort of tech platform that allows monitoring of that patient when they're not in the clinic, but then also some sort of asynchronous communication throughout that interim time so that questions can be answered, so that the patient can have their concerns addressed in the interim before they come into the clinic. And that way you're not wasting extra time there, which means you might do one of two things. One, the appointment itself becomes more effective, which means the patient might need less of those appointments in order to achieve their functional outcomes or their desired goals. But then also it might mean you can compress some of those times. So instead of it being now a 1 hour physical therapy appointment, for example, it can be a 30-minute physical therapy appointment, and then you can get another patient in, which improves the access for the clinic as a whole, for the population, for the general community, because now you're able to see the patients for less time. But you're not losing anything on the billing on the business side either. And the technology can help streamline some of those, the processes, the administrative processes on the back end, so that it's not an extra burden to see another patient. If given the choice between seeing one patient for an hour or two patients in an hour, a lot of therapists I know will pick one patient for an hour because there's one note that you have to document. So if there's a way that the technology can streamline some of this so that it's not an extra 15 minutes of documentation, but it cuts that time in half, maybe less, then that also helps from the clinician standpoint kind of incentivize that as well.